Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Well, it starts out as what appears to be a small problem, some numbness in the extremities, maybe some pain in your legs or arms, but peripheral arterial disease can lead to much bigger problems, and it is something you need to have treated right away. And here to talk about this is Dr. Ashwani Kumar of the Virginia Cardiovascular Specialists. Doctor, thank you for being here.
Thank you for inviting.
First of all, as simply as you can, describe to us exactly what peripheral arterial disease is.
Basically, the peripheral arterial disease it's the narrowing of the arteries which supply blood to your legs, to your brain, to your stomach, and to your kidneys. And if you ask me, most of the time, what I relate peripheral arterial disease is to the legs, because that's the most common site which is affected.
And that leads me into my next question. So how would someone even know that this is a problem?
There are certain features actually which can warn you that maybe you are having this disease, but let me tell you one thing. 50% of these patients with the peripheral arterial disease, they do not have any symptoms.
Oh, okay.
So the rest of the people, those who have symptoms, usually they have pain in their legs. That's a typical symptom, which comes on exertion, and it goes away when they take rest. This is a typical symptom. Again, it's not the most common symptom.
Right.
Most common symptoms are mainly very vague symptoms like easy fatigability, tiredness, or slowing down in general, because this disease affects the elderly people, and most of the time they will blame it on age.
Right. Okay.
So if something like this is happening, that's something like they need to be concerned, and they should consult their
because
doctor.
it lead to a much more serious problem. Explain that.
It can. The peripheral arterial disease is a serious disease, if you ask me. So it can lead to a very grievous consequences later on. And one of them is that it can lead to the ulcerations which don't heal over a period of time because there's a poor circulation to the leg, and ultimately lead to gangrene. And it's a stage which will lead to the amputation of your limbs.
Right.
And if you look at that, once you have a limb loss, your mortality, it goes very high as 45% of these patients, those who lose their leg, they will die in first year.
All right, so it's not something to ignore. If you think you have a problem, see your doctor as soon as possible.
Exactly.
All right, doctor, thank you so much for that advice. We appreciate it. And as always, you can learn more about conditions like these and the doctors treating them by going to our website, NBC12.com.